everybody, it's Olivia with Freedom at the Mat, and thank you to another episode of Well Chat. Today, we have some really insightful information for you, as always, but it's about a topic that's personally impacting me and many of my friends and loved ones. It's menopause. So, I have an expert who's going to help us understand and make peace with menopause. Dr. Stephanie Young-Moss is a highly regarded pharmacist and women's health advocate. She's passionate about empowering women, particularly over 40, to live their very best lives. Her expertise in pharmacology, nutrition, and wellness helps countless women make informed decisions about their well-being. She has been quoted throughout the country on various platforms, and she's here with us today. You're so high. Thank you for joining us, Dr. Young-Moss. How are you?
Fine, how are you? Thank you for having me. I'm so happy to be here.
I am thrilled to be here. You know, I am grateful that my hot flashes have somehow staved, which is even allowing me to have this conversation with you today without water and without, sweatpants, with the whole thing. But I want to get right into it. Can you define for us, Dr. Stephanie Young-Moss, once and for all, what is perimenopause? What is menopause? And what is postmenopause? Like, explain to us when it's happening, what's happening, all three phases.
Okay. Well, I will start off with menopause because that's the one that we all hear about and that we all seem to only think that's the only thing that can happen and that goes on with us. So let's start there. So, menopause, the scientific definition is not having a cycle for 12 months and 1 day. That's when you consider to be menopause. Your your sex hormones, typically estrogen, will start to decline. Testosterone also declines as well. People don't realize that. But these hormones will start to decline, which typically marks the end of your reproductive phase. Now, the average age of menopause typically in the US is somewhere between 49 and 51. And perimenopause means around the time of menopause. So perimenopause can be anywhere 4 to 10 years prior to menopause. So some women can actually start to experience that in their mid to late 30s, just depending on the person. They may start having certain signs and symptoms where it's starting to show that they have a fluctuation in their hormones. And a lot of times this is the most symptomatic time of a woman's life for the menopause stage. So there may be things such as sometimes hot flashes, but typically what people will see first and don't realize it will be mood swings, mood changes, cycle changes. It could be itchy skin, dry skin, where your skin just starts to change overall. So those are some of the first things that people could possibly see, even a change in libido as well. Now, postmenopause is after menopause. And this is, say, after that 12 months and 1 day, you're considered to be what's called postmenopausal. So, really, menopause is only really like a day. You're 12 months and 1 day is menopause, and then you're considered to be postmenopause. Now, these are all just the scientific terms of those definitions.
So 12 months, no cycle, 1 day, that's the menopause day.
12 months and 1 day, yes. Hmm.
And then after that, which is what I've been experiencing now for 2 years, so the hot flashes and all of that, the loss of estrogen, that's really happening in postmenopause.
It's happening. Well, yeah, because you start to lose, your estrogen starts to fluctuate in perimenopause, and then you start to lose. Your estrogen is pretty much, very, very, very low during that phase, like the end of perimenopause and menopause, and then postmenopause is when you are just considered no cycle, no anything, and you're postmenopausal. But people can still have signs and symptoms postmenopausal. So people hear postmenopause and they think, well, it's over. I don't have to deal with it anymore. But some people may still have some of those same signs and symptoms during that time because estrogen supports a lot of different things in your body. So therefore, you still may have some of those signs and symptoms.
So can you I have a real question in a second. It's going to go into like hormonal therapy because I know you're a pharmacist, but I want to go into postmenopause, the time period. I understand the amount of time for perimenopause is 4 to 10 years. I understand the one dayness of
Mhm.
menopause. Postmenopause, how long does that go on?
Well, it just depends. So some people may not have signs and symptoms. Excuse me. Some people may still have signs and symptoms where they're still having some hot flashes and things for a couple of years. But then some people, I've heard of people in their 70s still having hot flashes. So it really is an individualized case where everyone is different. So I don't want people to think, oh, I'm going to have hot flashes still in my 70s. That may not be the case for you. You may just be the one that only had them for a year or two because everyone's different. And some people have symptoms, during perimenopause, menopause, postmenopause, and then some people don't have anything.
Okay.
So it's really on a case by case basis for each
And
person.
I appreciate that. And even as you're speaking, it's bringing to light the fact that I believe that it's over for me. I believe it's over. I started around 48. And I remember that I had hot flashes like crazy for like a year. And it was just like I was teaching at the time. I'd be in a classroom. It was just embarrassing. But now it's over. So maybe it's over. Maybe I'm one of those people that it was last for a year or two. But now, I want to talk about the risk and the benefits of taking hormones because when I was going through it, when it was really, I think for many of us who are going through menopause, whether it's peri, menopause, or post, we're struggling. And it is just
Mhm.
disgusting. You're breaking out in night sweats, day sweats. And so we're looking into hormone therapy. And there have been all types of misconceptions or misperceptions around hormonal therapy risk and benefits. Can you once and for all give us your insights on the benefits and the risk of hormonal therapy?
Mhm. Well, I think first for everyone, it's a individualized basis. Like I said, they always have to talk to their healthcare professional because everyone's medical history is different. Of course, I have to give that disclaimer, right? When it comes to hormone therapy, I think when you think about replacing estrogen, estrogen is not just for reproduction, right? It supports a lot of different things in your body. It supports your bone, it supports your skin, it supports your heart health, cardiovascular health, same thing, but it supports all of that. So when it comes to when you have decline in estrogen, that's why some people may see some of those things like their blood pressure sometimes can go up. They may have may be at more risk for fractures and things of that nature when they get older as well. So when people choose to replace hormone therapy, that's what they're trying to protect a lot of times. So not just the sex hormone benefits that you hear about, but they're also trying to protect their cardiovascular, their bone health, and all of that. So you have to make sure that you are talking to a reputable healthcare professional because when it comes to your particular medical background, you want to make sure that it's right for you because everyone, of course, can't take hormone therapy. Typically, if someone has a breast cancer or another type of cancer that is hormone based or dependent on hormones, that's when they will not want you to take hormone therapy because it can make that worse. Now, people are saying, well, can hormones cause breast cancer? Can hormones cause this and that? The thing is, hormones won't initiate it in you, but if you do have it, it can make it grow faster. So that's why they don't want you to take it. Then there were some studies in the early 90s that came out that talked about how much there was a risk for taking breast cancer. Excuse me, there was a risk for taking hormones rather. The thing is that in these studies, they were taking synthetic hormones that were not natural forms of hormones. So there were some of the older forms of hormones. So some of the increases that they saw there, the women were already high risk that were taking it, and they were taking synthetic hormones. So that's why the risk looked greater. But now with the newer hormones, they're not seeing that risk as much as they were seeing in those old studies. And also, when you think about some of the risks of our everyday life, you have to weigh out the risk versus the benefits because drinking wine 3 to 5 times a week and obesity are also high risk of causing types of cancer. And actually, hormones is actually a lesser risk than those types of things as well. So people need to look at their entire lifestyle when they're looking at what they're doing, when they're looking at whether hormone replacement therapy is right for them, and see if the benefits outweigh the risk for them.
can you go into some of the different types of hormone therapy?
Mhm.
I know
Yep.
that I don't know anything about this. I don't even want to kind of spout out a couple of them, but I know that there are different types and different levels and different estrogen levels. So, can you define for us some of the different types of hormone therapy that are available?
Yep. So there are various types of hormone therapy. You have patches, you have pills, you have combination products. So if you have an intact uterus, which means you still have a uterus, you have not had a hysterectomy, then you would have to take a estrogen and a progesterone, because progesterone actually protects your uterus, because you don't want to just take estrogen if you have a uterus, because that can be a cause for cancer. So you have to have the protection of both of those together. So typically, all healthcare professionals know, if I have a woman that still has a uterus, she has to have estrogen and progesterone. And progesterone is a very important hormone because it helps with things like your mental health. It helps with your sleeping and how well you sleep through the night. So it's also a benefit as well. But you have to take both of those together if you have a uterus. If you don't have a uterus, then you don't have to take both of them together. But there are all different types of forms. There is a local vaginal, like I said, you can take a suppository, or you can also take a cream. So some people that may not want to take something internally, where they feel like, well, I'm going to be taking this medicine and I really don't want to. There are also cream where you can do a local application to the vaginal area, and then that can help some people if they're having atrophy or anything that's going on in their vaginal area. And even an increase in UTIs can happen for some women in menopause, but a local cream can also help with that as well. But there's various types. You have your combination products that has both together, and then you also have some that are just individual, where you may just have your estrogen and your progesterone separate as
Any
well.
differences in effectiveness of the combination, the solo, or the local?
Yeah, so the local won't help with things that I mentioned earlier, like the cardiovascular protection and your bone protection, because it's just local, and it's not systemic. But the patches, the pills, the suppositories, they will help with those, because they are metabolized through the
Okay.
liver. But typically, the patches are a little bit less than the pills, because personally I take a patch. I actually prefer a patch from myself, because it's not metabolized as much as through the liver as the pill is.
So, what about hot flashes? Which one's going to help with that?
Well, for hot flashes, it would be the patches, and the pills would be the if people are looking for relief for that, because FDA approval, the pill and the patches, those are the ones that are most considered most effective, or according to Menopause Society, is most
Okay, so
effective.
now what if I only want to take these because I'm really nervous about medicine? I want to take them for a short period of time, but not for like an extended period of time. Will I see any relief?
Yep.
Will it be just for like,
Yep.
I'm having hot flashes and I want to take them for 2 months to try to stave them away? Or do I have to take it for the entire time that I'm going through postmenopause?
You don't have to take them for the entire time, and typically people think that, if I'm taking a patch or whatever I'm trying to take, that it's not a large dose of estrogen. It's just a small dose over time, that people have to really think about that. So it will give you relief. Now, when you come off of it, there won't be a rebound, but you could have a hot flash or two that will come back, just depending on where you are in your phase as far as menopause and perimenopause. So you don't have to take them for life, and let's just hope that it will begin to, it's your body, it's kind of like your body kind of gets used to, for instance, if you're hot, or say if you're cold, your body gets used to the cold. Your body kind of gets used to those levels, and it will start to adjust for that as
Is
well.
hormone replacement therapy expensive and where do I get it? I don't know anything about this. Just imagine the sister who's listening is like, I'm interested, but where do I get it?
Right. So of course you would have to go to a healthcare professional and get them to write your prescription for it. And that people think that, I have to get this compounded, or I have to get a special brand name, and you don't. Hormone replacement therapy, especially the patches and the pills, they are generic form. And they could be they're so that's the cheapest level on your copay, right? And even if you don't have insurance, it's still a very nominal cost, because it's generic. So people think it's this expensive thing. And if they're going to get it compounded, it will be expensive. But you don't have to get it compounded. You can go to your healthcare professional and say you're interested in learning more information about a generic patch or your generic progesterone pills, and they will be able to write you a script for a generic medication.
Okay, so I want to go deeper. You mentioned a healthcare professional, of course. But let's say I really don't know. Do I have to go to a primary care, or can I go to a primary care? Do I have to go to a gynecologist? Do I have to go to a pharmacist? Like, who do I go get the script from?
Typically, you can go to anyone who has prescribing authority in your state. So that will be your primary care or your
Okay.
OBGYNs or your even your internal medicine nurse practitioners. Some states pharmacists have licensing, well, they have prescribing authority as well. So I would say just ask around or even go to the Menopause Society website. They have resources of physicians in your area that can help as well. But typically, if say if you go into a primary care doctor and you've heard that they know what they're talking about when it comes to menopause, then that you can go to them as well. You don't have to do OBGYN if you don't want to.
Now, Stephanie, you know I'm a roots rock reggae kind of girl. All these locks, we sipping on tea and incense and sage. We already know this, right? So I don't want to touch any pharma. I'm sorry. I'm so grateful that you went through all those years of school and then you're very reputed. And I love that you're a pharmacist. But I don't want to touch anything. I don't even want to have a Tylenol. I don't want to leave. So for girls like me who are like, nah, I'm straight, I'm gonna use some natural or homeopathic remedies to help me stave off my hot flashes and my various impacts of menopause or perimenopause or post. Have you heard of any?
Yes. So yes, and I believe in integrative medicine for myself. So I believe that some people need scripts and then some people don't. And sometimes you can do, both. Some people need both. So what I like to do is tell anyone to start with lifestyle modifications first. So that's looking at your diet and your exercise. What are you eating? What vitamins are you missing? Things like vitamin D3 with K2, magnesiums, those are all things that are very helpful with symptoms of menopause. And actually, a deficiency in vitamin D can actually make menopause symptoms worse and actually mimic menopause symptoms. So it's always good to kind of look and see what do your levels look like in your vitamin levels and kind of start there. And if you don't want to, if you the type of person who don't even like to take vitamins either, just make sure that you're getting the type of foods that have those vitamins in it. So look that up as well. But there are things such as teas. You have chasteberry, you have maca root, black cohosh. All of those things are natural herbs and teas that have been shown to help with hot flashes and things of that nature. But you still have to make sure that you're getting them from a reputable source, right? Because every supplement is not creative equal. So if you have a place that you've been using and you think that they have a reputable herb reputation, then use them. But typically, you have to just make sure you have it from a reputable source as well.
How do we know? Okay, Dr. Stephanie, I've heard it before. I'm so glad you brought that up because it's like a lot of us think we're doing good just to even add vitamins to our everyday healthcare routine. But then we don't know about the levels. There's levels to it. So how do we know if it's a reputable herbalist?
Well, what I personally like to look at, so if I'm buying, let's say a bottle, if I go to the Whole Food store, I don't, that's not what I want to say. If I go to the herbal store and I want to make sure that I have, if there's a bottle, I'm looking at the back to see if it's manufactured in an FDA facility because FDA will go and check the facility just to make sure that they're doing things the right way. And then also, I make sure that they are practicing what's called GMP, which is good manufacturing practices. A lot of times that'll be on the bottle as well.
Okay.
And you can just see if they are, that just means that their facility has been coded that they're doing everything the right way. So those are the things that I look at when it's on a bottle. But if you're going to like a real, say a real herb store where they just have it, where they're getting it out of a jar, I mean, that's a little bit harder because you won't be able to see how they manufacture it, the sources that they're getting it from. I think all of those things are important as well.
Very well. And I want to go back to those vitamins because you mentioned them. I caught a couple of them. And we'll put them in the description too, along with links to your book and more information from you. Vitamins B2, K2, magnesium, and vitamin D.
Well, vitamin D3 and K2, a lot of times that's a combination because you would really like to take those together because vitamin K2 helps push vitamin D into the bones. instead of it, going around circulating your blood. And then also magnesium. And there are various types of magnesiums. I have several videos on the different types of magnesiums and what they help with. And then also, you mentioned vitamin B. I didn't say it, but a B complex is actually good for energy and things of that nature and focus as well. So that is actually a good one as well.
Awesome. Where are those videos? Go ahead and tell us now. Where are those videos about magnesium?
On YouTube. So you go to my YouTube page, Dr. Stephanie Yomo. I have videos on there as well.
Awesome. We'll put that in the description as well. Thank you. So, is weight gain just part and parcel for menopause? I feel like because I'm in the age group, I see a lot of YouTube videos that come up when I'm looking for other content that's saying dealing with stubborn belly fat, like this is how you lose it in menopause. So, is it just something that we have to accept that comes with it, or are there things we can do during menopause to minimize our belly fat gain?
Well, remember, I talked about estrogen being cardioprotective and also being cardiometabolic protective. So that's one thing it's also protecting you from as well. So I will say that if you are exercising and you're eating the same way you were when you were 18, you can't do that, right? There's a lot of things that we used to do when we were 18, 20, 21 that we can't do now that we're 40, 45, 50. So what I like to do is make a journal of what I'm eating, what I'm drinking, how I'm moving, and see how that correlates to my weight. If I'm doing the same thing, the same routines that I was doing, then I need to adjust something. So it may be something I need to either add to my diet, take out of my diet. Maybe there needs to be a new exercise routine that I take up instead of what I used to do, add something on, take something off. So those are the types of things that I like to do to try and adjust and see and journal. How am I feeling now and what am I doing? And how's my body feeling as well? So I think adjusting what you do with age can also help with that too.
Yeah, it's age. We can't blame everything on menopause. We put on everything on menopause. We have to stop. So, so another question around menopause, mental health. Tell us more from what you know from your research, from your studies, and from your clinical observations with various patients who are dealing with menopause. And I want to talk about your book in a moment too, Menopause in Color. What do you know about the impact on our mental health and any behavioral changes that come during menopause?
Mhm. So, with those fluctuations, especially during perimenopause, a lot of times with those fluctuations, you'll start to see mood swings and mood changes. A lot of times, this is due to the decrease in estrogen, but also progesterone is very important in mental health as well. So, a lot of times, people will start to see some types of changes. I've seen people saying where they may have had a diagnosis of a mental health disorder. Let's say if they were diagnosed with OCD, and they got everything under control. And then once they reached perimenopause or menopause, they started to see it come back. And it's because those hormone changes kind of brought that back. So if you have a history of it, a lot of times you can be at risk for it coming back. But then there are some people who have a new onset of either anxiety, depression, or OCD because of those changes in the hormones. So many times vitamins can help. Magnesium is also it's great for mood. Besides hormones, those of course that can help, but magnesium is also a great source for that, and the vitamin D's that I talked about. But women are starting to see, well, there's a study that shows that the largest the age when women are the highest suicide rates is actually between like that 45 and 55 years of age, and people really aren't correlating that with menopause. But we really need to sit back and look at more studies and see what is causing this. Is it due to hormonal shifts? Is it due to life changes? Things happen, you're raising kids, then something happened with your parents. Is it stressors? So all of those different things can play into it, but they have been showing some studies that some of the first signs and symptoms that we see with hormone fluctuations are those mental health challenges that people may see pop back up at times.
So, thank you. In your book, Menopause in Color, can you walk us through some of your key takeaways and some insights in your book that shed a light on how women of color experience menopause differently?
Mhm. Well, with the book, it really is a way for you to keep up with what's happening with you during menopause. So it does have all of the things that I talked about. I have different herbs, vitamins. It talks about all of that in the book as well. But it's a journal for you to keep up with what are your signs and symptoms. If you added on vitamin D3 and K2, how did that affect you? What are the notes when you talk to your doctor? What did they tell you about? What age were you when you saw your last period? So it helps you keep up with all of those and helps you adjust and keep track with what's helping you. I think it's a great resource to help empower you for taking charge of your own health, but then also it's a way for you to pass down this information to others. It may be your niece, it may be your daughter, because how many of us can remember what our mother and our grandmother went through for menopause? A lot of times we don't know. So that's also what this is a great
So
resource for as well.
it's like a legacy book for me to share this with the next generation of what my menopause experience was, so I don't feel so alone when I go through it.
Yep, yep. And then it also has great resources for you as well if you have questions about those vitamins and those herbs and different things that you can do, whether it's exercising or having a fan, like different things and ways that you can cope with it as well.
Wonderful. I'm going to ask a question. Don't have to answer it because what you said is going to be the answer to it. So I'm going to ask the question and put it back in. So tell us more about your book, Menopause in Color. Can you share with us, like, what is the experience of it? What is your key takeaway for your book? Key, and we'll go back to that. Cool. So your work, Dr. Stephanie, I know you focus on health and wellness and empowering women over 40. Why have you chosen to focus on that particular age group?
Well, I think that is a time in our lives when we have been told by society that we should be looking a certain way, acting a certain way, getting ready to sit down and taking life, putting life on the back burner, right? But I think it should be the total opposite. I think that there are so many times that this is a time for thriving. It's a time for expansion of joy, expansion of your territory, because we are actually learning who we are now, right? We are knowing what we want to do. We're knowing where we want to go. We have a lot of wisdom and experience behind us, and it's time for us to thrive during this time. So I chose that age group of women, because I think a lot of women may think that may be afraid of aging, but I want us to be pro aging and excited about what's the next chapter of our life. So that's why I chose that age group as well.
Excellent. So if you were to create a women's wellness resource hub for women over 40, what would be included? If you had 5 items included in that resource hub, what would it be?
Well, which you say if I would create, I need to be creating it. How about that? It would be any information about. It would be about hormones. It would be about natural ways that you can also help yourself, which I do actually have some of that on my site. It will also be a great resource for how you can find healthcare professionals that are familiar with women of color and how they can help them as well. It would also have information about mental health. Mental health. How can you take care of your mental health and those types of things too?
Very well. And then, final couple of questions for you. What are 2 essential elements of a successful health education plan for women who are navigating their 40s and beyond?
I think having a community is very important. I think a lot of times we sit in silo and we don't understand what's going on and that the person next to you is going through the same thing. I think that even when I started talking about this on social media, people were afraid and like, oh my gosh, I can't believe this is what has been going on with me. I've been talking to my doctor and no one is helping me. They're not realizing we're all going through the same thing. We're all experiencing this. So a community is so, so very important. And then also making sure that you have a great relationship with your healthcare professional. I think it's important having someone that's knowledgeable and that will listen to you and that will take your concerns to heart and understand that everyone is individualized and that they will listen to your concern and make up a plan with you in mind when they are trying to help you as well.
Dr. Stephanie, thank you for that. Let me ask you a question about that community piece, right? I have recently come to that conclusion that that's one of the elements of my life that I'm missing, having relocated from New York to New Orleans. And I realized, I need to really work on building my community. And I think that many women over 45, over 50, we began to find that our community is shifting, whether it's people are passing, whether it's our children are growing up and they've gone to university, whether we're going to divorce. Do you happen to have any recommendations for how we can build community since that's such an essential element of our healthcare education and maintenance and management, rather, as we get older?
Yeah, I think so. First of all, being open to not being afraid to go places by yourself. I think that's a great way to meet people and to be able to talk to people as well. I think that's one great way, especially moving to a new city. When I moved to Indianapolis 25 years ago, I knew one person. And now I have a very large community. And I know that was a long time ago, but it was just by me meeting people. It was by me getting involved with organizations in the city. And also, even online now as well, whether it's getting into an online community, it could be a free resource. We have Menopause in Color on Facebook. We have women there that are in different parts of the city that you can connect with as well, that kind of are going through the same thing you're going through and that kind of may be like minded as well. So, whether it's Menopause in Color or whether it is a travel Facebook group or anything, I think it's important to meet people that way as well.
Very well. So we will join your Facebook group, Menopause in Color Facebook group, right?
Yes, yes.
Excellent. Last couple of questions for you. What are some common prevalent misconceptions women have about health and aging after 40?
I think that as far as aging, people think that it's over and that you're not desirable and that you need to just go sit in a corner somewhere, and that is total opposite from the truth. Like I said, I think it needs to be pro aging. We're not anti aging. We're pro aging. We're for aging, and we're aging gracefully, right? I don't. My 20s was great, but there are some things in my 20s that were not so great, and that I don't want to go back to. So to me, this part of life, you always hear people saying, no, your 50s is great. And then I'm hearing people in their 60s like, oh, 60 is fantastic. So speak to people like that as well. I think it's important. Get that communities. If you're 50, get somebody that's 60 to talk to you about how much fun they're having. If you're 40, get somebody that's 50 to talk about that as well. So I think just having something to look forward to in those decades is important, and always reinventing what you like and what you want to do and trying new things. I think is important to help you with your aging as well. And also keeping up with your health and wellness is so very important. What does 80-year-old Stephanie need now from 50-year-old Stephanie?
And that is my final question for you. What is your personal wellness routine? Are you willing to share with us some things you do every day or every week to manage your own personal wellness?
Yeah, so I at least try to work out about 3 to 5 times a week. Let's say mostly three, but especially strength training. Things like strength training is so important because your muscles and your bones is important for your longevity. And people don't realize that muscles and bones are related, right? They need each other to support each other. So when what am I doing now at 50 that I want to make sure that I'm keeping up with? And one thing would be strength training. I make sure that I'm drinking enough water, drinking a lot of water, and having a great protein intake too to help support that as well. And then, of course, I take my vitamins and minerals. Besides my hormone patch, I take vitamins and minerals every day, especially the vitamin D3 and the magnesium. I take that, and then also take creatine, which supports muscle as well. So those are just some of the things. And of course, I get up an hour before everyone in my household so that I can have my own meditation, prayer time. Because if I don't do that, the day is not going well. So I like to make sure that I'm getting up before everyone as well for that.
Wonderful. Thank you so much, Dr. Stephanie. I know we're going to support you and join your Facebook group, Menopause in Color. Are there any other resources we should tap into? We've got your YouTube as well. And
Yep.
are there any other exciting projects, any other places we need to support you or can support you?
Yeah, you can just go to my website, drstephanieyomo.com. I do have resources on there. I have free resources besides the book, of course, that costs, but I do have free resources on there as well. And you can read about my book. And then I have a retreat coming up in September that you can see all about on my website as well. And menopauseincolor.com.
Excellent, excellent. So thank you so much, Dr. Stephanie Young Moss, for joining us today. I know that we are like more enlightened and we're all better for the information that you're committed to sharing with women of color and women in general, especially those of us over 40 years old. So thank you for making the time and space today. Continue on your journey of spreading light and love. We appreciate you.
Thank you.